Pastoral counseling has deep roots in Judeo-Christian history. Charles Gherkin noted that structured care in counseling has existed as far back as the collective memories of the Christian community can be extended. The oldest Judeo-Christian model of care rests on a threefold tradition. Prophets assured continuity of tradition, priests organized worship, and the wise men and women provided practical guidance in daily life. Klepst and Jekyll described pastoral counseling as a specific constellation of helping acts done by representative Christian persons directed toward healing, sustaining, guiding, and reconciling troubled persons whose troubles arise in the context of ultimate meaning and concerns. Klepst and Jekyll identify four basic functions of pastoral care that emerged in the early church: healing, sustaining, guiding, and reconciling. Attempting to balance these functions was based upon the specific need of the church. The medieval church codified care as a sacramental system to emphasize illness and healing. During the Enlightenment, care was organized around sustaining souls in a treacherous world. Pastoral care is always culturally situated and shaped by the interaction of those factors in particular times and places. Pastoral counseling emerged as a 20th century specialty among North American Protestant clergy who incorporated new psychological information into their ministries. By mid-century, it was a ministry specialty requiring distinctive training. As a movement, pastoral counseling mirrored a Euro-American, middle-class, mainline Protestant cultural periods. By the late 20th century, it was institutionalized with a clear set of expectations reflecting particular theological, psychotherapeutic, ecclesiological, and organizational ideologies codified into standards of accreditation and practice. Pastoral counseling is targeted to individual problems and looked primarily to psychotherapy as an intervention of care. The clinical pastoral training movement set the stage for pastoral counseling to develop in several ways. First, it solidified a frame of reference for ministry specialties to focus on mental health needs. Second, it provided clinically trained leaders who would stimulate pastoral care specialization. Third, it consolidated an interdisciplinary medical, psychological, and theological context in which practical ministry could test and integrate counseling methods. Fourth, clinical education defined ministry to troubled souls in a way that bridged congregational life and the other contexts of healthcare. Foundational works in pastoral counseling agreed that this ministry emerged as a 20th century expression of North American Protestant clergy. Limited information is available about other cultural experiences in pastoral counseling. However, many African American leaders were passionate about their education and work in pastoral counseling and amplified the importance of pastoral counseling in diverse cultural settings. Social and religious changes have reshaped pastoral counseling training, practices, and identity. Pastoral counselors are the bridge linking religious and spiritual concerns with the behavioral sciences. Pastoral counselors have a rich tradition to build upon by meeting needs in the behavioral sciences through the love of Christ. Pastoral psychotherapy is variously defined, but tends to involve longer-term therapy and in some instances is difficult to distinguish from general psychotherapy. While in the past, pastoral care and pastoral counseling were often used synonymously, today they are distinguished. Pastoral care refers to pastoral communication that helps and nurtures persons and interpersonal relationships in supportive ministries, such as visitation of the sick. This may involve the use of counseling skills, but in a briefer and less therapeutic complex manner than in pastoral counseling. In a sense, pastoral care is a form of pre-counseling that takes place outside a formal counseling context. Pastoral counseling is a more structured and complex form of pastoral communication that starts after an articulated request for help and is carried out in a formal counseling context. Specific arrangements for sessions, times, and fees are mutually negotiated in pastoral counseling. Clientele of pastoral counseling are persons struggling with life transitions, emotional or relational crisis, guilt, abuse, addictions, or low self-esteem. As in secular psychotherapy, personality is typically a goal of pastoral psychotherapy. A relationship that develops between client and pastoral counselor varies. In some instances, the pastoral counselor takes the expert role and offers interpretations and advice. In other instances, the relationship is one of mutual collaboration. This relationship style is commonplace in spiritual formation. Treatment interventions usually include active listening and other problem-solving or solution-focused counseling methods. They may include advice on religious or spiritual matters, such as forgiveness. Similar to spiritual formation, pastoral counseling typically draws on the resources of the client's faith community for healing, growth, and integration. For certain issues of psychotherapy, pastoral counselors are likely to refer clients to mental health professionals. Like spiritual formation, pastoral counseling is currently in the process of becoming a recognized profession. This means that issues of training, certification, and professional identity are central concerns. An increasing number of pastoral counselors are licensed to practice, usually in one of the mental health specialties, such as a licensed professional counselor. Additionally, certification is available from the International Board of Christian Care, a subsidiary of the American Association of Christian Counselors. The American Association of Christian Counselors is a professional organization that represents nearly 50,000 members. The American Association of Christian Counselors is open to all qualified mental health professionals, pastoral counselors, pastors, chaplains, paraprofessionals, and lay counseling ministry leaders who identify themselves as Christian counselors. The intent of the AACC is to equip clinical, pastoral, and lay caregivers with biblical truth and psychosocial insights that minister to hurting persons and helps them move toward personal wholeness, interpersonal competence, mental stability, and spiritual maturity.